Hi, I'm Dr. Richard L. Robles. Food sensitivities are a confusing topic for many people. Most people don't really understand what they are. As a matter of fact, most doctors don't understand what they are. In this video, I'll explain 4 areas of concern when it comes to food and give you a brief explanation about each of them. Many people may have problems with a number of different foods, and oftentimes they don't even know it. The most common culprits are wheat, dairy, soy, corn, and eggs. To help you understand this topic better, I'll talk about gluten. However, the same information applies to other foods I just mentioned as well. Nearly everyone has heard of gluten-free foods and gluten-free diets. But what is gluten and why would people want to avoid it? Gluten is one of the proteins found in wheat, rye, and barley. Wheat or gluten can also be hidden in many foods, oftentimes listed by other names such as modified food starch or hydrolyzed vegetable protein, just to name a couple. Foods like wheat or gluten can cause different types of reactions for different people. It can even cause symptoms that are not traditionally thought of as digestive symptoms, such as headaches, brain fog, fatigue, and joint pain. That's why this is a problem that needs to be identified and explained. There are 4 areas of concern with foods. The first, food allergies. This is an immune response that's often related to the protein component of a food. A food allergy is an immunoglobulin E-mediated response that usually affects your entire body. Symptoms typically begin within a short time after ingestion and can include rashes, hives, swelling, difficulty breathing, digestive problems, fainting, and it can even result in death. Food allergies are usually identified at a young age and are known to most adults. However, if you're not aware of having an allergy, it doesn't mean that you're in the clear. For example, research shows that only 1 in 8 people with full-blown celiac disease have severe digestive symptoms as their primary complaint. This brings us to number 2, autoimmunity. This is when your body's immune system attacks your own body. Autoimmune diseases are on the rise, and some common foods like wheat or dairy can trigger these immune responses, causing further destruction of your body. Common autoimmune diseases are celiac disease, which affects the small intestine, Hashimoto's thyroiditis, which affects the thyroid, diabetes, which affects the pancreas, and multiple sclerosis, which attacks the myelin sheath around your nerves. There are many other areas of the body that can be affected by autoimmunity, and the food you eat can be a trigger due to a process called molecular mimicry. The simplified explanation of molecular mimicry is that some foods have amino acid sequences in their proteins that are similar to the amino acid sequences found in our own body tissues. When the immune system marks those proteins as a problem to be destroyed, there will also be destruction of the tissues in our body with similar amino acid sequences to the food. This causes the tissue destruction, which leads to autoimmune disease. Number 3, food sensitivities. This is an immune response that typically involves a delayed immune reaction that can occur either right after eating a food or as far away as 3 to 5 days. It's usually measured by immunoglobulin G and/or immunoglobulin A immune responses. The frequency of food sensitivities is greatly underestimated and underdiagnosed. This is the primary reason why many people feel better after maintaining a gluten-free diet for longer than 2 to 3 weeks, and after reintroducing wheat or gluten, oftentimes have symptoms. This is also why the gluten-free fad will likely not go away and why it's continued to gain traction. Food processing shifts and agricultural shifts over the last 75 years have created combinations of food that are more pro-inflammatory than our bodies are used to encountering. The inflammation decreases our ability to break down the protein components of the food sufficiently, resulting in immune reactions to food proteins known as food sensitivities. Number 4, food intolerance. This is not an immune response to eating a food, but rather it involves the incomplete digestion or breakdown of a food that can cause symptoms nearly anywhere in your body. This can include lactose intolerance, fructose intolerance, and difficulties with food dyes and other components of food. In my clinical experience, most intolerance to foods is accompanied by a food sensitivity, and in some cases the intolerance to a food is actually an immune response, or a food sensitivity, and it's been misidentified as an intolerance. More and more people are finding that following an anti-inflammatory diet may be part of the solution to their health problems. A question I often hear is, I've eaten wheat or dairy my whole life. It can't really be a problem for me, can it? Unfortunately, it can and often is. Wheat has been changed by crossbreeding, exposure to radiation to alter its genetic structure, and in food processing changes such as deamination. Our wheat is not the wheat that was present in historical times, nor the grain that was eaten by our ancestors. Whether we're talking about wheat or other foods that have been changed genetically or chemically, understanding that they may be causing an inflammatory reaction inside of us is really important. You see, our bodies are designed to provide us with symptoms when we're not caring for them properly. We just have to learn to pay attention to those calls for help and move away from reactively silencing them with medications. It should not come as a surprise that consistently eating adulterated food causes poor health and that our bodies will let us know with symptoms. We're that well made. This leaves you with an important question. Is an anti-inflammatory diet right for you? For more information about how we can help you, contact our office or visit us online. Once again, I'm Dr. Richard L. Robles. Thank you.